The NFL took shape in 1920, but it took more than 2 decades for helmets to be used in the sport. The first football helmets were made out of leather and didn't offer much protection. A couple years later, the NFL officially adopted plastic helmets that have since been continually improved. But even with the best technology, the game of football is structured around big guys and hard hits, so injuries aren't surprising. And though broken bones do heal, there's one injury that sticks with some athletes until they die, called chronic traumatic encephalopathy, or CTE.
This is a progressive brain disease. It's similar to Alzheimer's disease, but there are some clear distinctions between the two about when you look at the brain. Right now, CTE can only be diagnosed accurately after someone passes away and we're able to look at the tissue under a microscope. So currently, one of our areas of our research is really focusing on how can we detect the specific signs and symptoms of this disease during life so we can accurately diagnose people while they're still living.
That's Dr. Michael Alosco, Associate Professor of Neurology at Boston University School of Medicine and a lead investigator at BU's CTE Center. Alosco says most people think major head trauma leads to CTE. And while that's true, it can also occur from repetitive minor impacts. This includes the repeated tackles that football players experience.
We at our center have found it most commonly in people who played American football, particularly people who played many, many, many years of American football. And that being said, we also know that people are exposed to these repetitive head impacts and people play American football and go on to do fine and don't develop any problems. So there's certainly other risk factors at play here as well. But that is something that's been common to all cases that have neuropathological diagnosis of CTE.
A 2017 study on CTE looked at 111 deceased NFL players. It discovered that 110 of them had the disorder, suggesting that CTE may be associated with prior participation in football. However, the disorder doesn't appear in all players, and scientists don't really know why. CTE can seemingly occur in anyone, and researchers are still trying to figure out if there's an underlying reason.
We see that CTE is always common to people who've had a history of repetitive head impacts. But we don't know why some people develop CTE and others don't. We know that repetitive head impacts is likely the key driver, but why do some people who have this history don't go on to develop CTE? And that's because other risk factors, like perhaps genetics, are at play, and that's really a question we're trying to figure out, is why do some people have the history but don't develop CTE?
The first diagnosis of CTE in an NFL player was in a 2005 study published in the Journal of Neurosurgery. Since then, researchers have been trying to figure out all of the mysteries of the disorder. Most importantly, how to diagnose it while a person's still alive. Alosco says the symptoms vary, but some can be more dangerous than others. A few former NFL players with CTE have committed suicide or murdered others before turning the gun on themselves. Part of Alosco's research focuses on trying to figure out the specific signs of CTE so doctors are able to give a diagnosis.
Right now, we see a constellation of symptoms of trouble with cognitive or thinking and memory problems. And really, this is focused in areas of memory and also more complex thinking abilities like multitasking, problem solving, something we refer to as executive functions. We also see changes to mood and behavior. Specifically, it's a term we call neurobehavioral dysregulation. And this is having a short fuse, being impulsive, easy to anger. That's what we mean by that term. And so these are symptoms that we've commonly have heard from families who've had loved ones pathologically diagnosed with CTE.
Alosco believes treating the specific symptoms on their own can help improve quality of life.
A lot of these symptoms, especially the mood and behavior, we know how to treat a lot of these. And so I think, addressing those and seeing if there's benefits is really important, and addressing the modifiable risk factors, things like living a healthy lifestyle. If you have sleep apnea, getting that treated. If you have depression, we have treatments for depression. So really focusing in on the things we know how to treat is important. And that all starts with going to a center that specializes in dementia and brain aging.
But if we can address individual symptoms, why do we need to find a specific treatment for CTE? Well, the disorder gets progressively worse as you age, regardless of additional head trauma. So Alosco says we need to fix the root cause of the disorder. One key player is a protein in our brains called tau.
CTE is characterized by abnormalities of this protein called tau in the brain. So the tau, we all have tau in our brain. It's really important for normal functions, but in things like CTE, it becomes folded, it becomes abnormal. It accumulates inside of our cells, and then it strangles the cells and causes cell death, and that's what leads to thinking and memory problems. So if we're going to treat CTE, we need to develop strategies where it helps to, or interventions where it helps to remove the tau or get rid of the tau.
Alosco says there are two components to identifying CTE. The first is looking at the signs and symptoms, which is still a work in progress. And the second part is finding biomarkers.
So it's markers that reflect kind of the biology of the body, in this case, the brain. And what we use there are things like magnetic resonance imaging to image the structure of the brain. We can analyze like the cerebrospinal fluid to look at different proteins of these diseases in the brain. And then there's other imaging techniques. All of these techniques are really well established in Alzheimer's disease to diagnose it accurately. And these are all being looked at in people at risk for CTE.
However, one of the issues with conducting these studies is that they take a really long time. Researchers are essentially having to guess if they chose a candidate who has CTE. This opens up the possibility of years spent studying a person who never developed the disorder. In fact, one person can have double the amount of head trauma as someone with CTE, but won't get the disease. And since part of the football's popularity is due to its physical nature, is there anything the NFL can do to help protect players without completely changing the game? The organization first acknowledged the link between football and CTE in 2016 when the research became overwhelming. The league has since instituted concussion protocols and the use of safer helmets, but Alosco says that alone isn't enough.
The NFL has done, I think, a good job with concussion, right, and managing concussion protocols. But this isn't a disease about concussion. We know that most people who have a concussion recover. This is really a disease about the tiny hits to the head, some of which might result in repeated concussions, but many of which result in no symptoms, but maybe still injury to the brain. And we're talking about these thousands of hits over someone's career, and these are just hits that are part of the game.
So without completely turning the game of football on its head, Alosco thinks CTE will continue to be a threat. You can find more information about Dr. Michael Alosco and all of our guests at our website, radiohealthjournal.org. For more behind the scenes, search Radio Health Journal on Twitter, Facebook, and Instagram. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
Coming up next week on Radio Health Journal.
It used to be that patients with Traumatic flow, not all of them survive to adulthood, but now the expectation is that most or all will live to be adults.
The incredible story behind a life-saving surgery.
Then, can you trust your online pharmacy?
I think the biggest misconception about counterfeit or falsified medicine is that it's not a problem in America.
All that and more on Radio Health Journal. I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
There are people that you can reach out to cold and say, hey, I see that you talk about becoming a teacher. I'm thinking about becoming a teacher. Could I get a 15-minute virtual coffee with you? I have some questions I want to ask.
The importance of mentorship. Then,
have been very stagnant, and they've withheld raises as well as just raising base pay.
How workers are standing up and demanding more. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more, and check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.